I'm here at the booth of Primary Record. They have a gigantic booth here, actually, and I'm talking to Gene, who is the CEO. Yes, okay. Explain to us what you do.
Yes, so Primary Record is solving the problem that families face when there's someone that's more medically complex. So more healthcare visits, more medications, and suddenly you have the family trying to support them and navigate the healthcare system.
Yep.
So
Caretakers are becoming more popular these days.
Yes, exactly. And so we're creating that a trusted platform for families to be able to pull the medical story together, to be able to use that data to navigate the healthcare system, find resources, and support each other.
Okay. And so, are you just correlating data from hospitals, or what are you doing?
So we have a whole premise around how to help families collect, organize, and share their medical information. So in collecting, we are able to connect to over 10,000 patient portals across the United States.
So that's hospitals, or what?
Yeah, so yeah, at your doctor's offices and your hospitals, whoever has a patient portal, there's an opportunity to search and then connect.
Okay.
And then so for each family member, you can connect multiple portals. And what we're doing is pulling that information and helping the families organize it in a way that's understandable for them.
So these portals, are they conforming to a standard, or?
Yes. So
what is that
the 21st Century Cures Act was passed in 2016, and it started a roller coaster here of making sure that all of these electronic health record vendors operate and standardize to the FHIR.
HL7 FHIR.
Yeah, it's a standard for.
Is it called the what?
HL7 FH.
Oh, HL7. I'm familiar with that.
Yes.
So there's a FHIR spec. It's a JSON or it's a standard, a JavaScript standard that everybody has to now speak.
I see.
And that's then affording the opportunity to finally connect to a portal and pull data into one centralized location.
I see. So I invest in a lot of angel investor, and there's a lot of companies that use blockchain to try to. I guess there's a challenge between different hospitals having different silos.
Right.
And they were trying to use the blockchain to allow interoperability and yet allowing access to the data, but yet HIPAA compliant, right? So.
Right. And so.
How is FHIR? How does that affect all of this dynamic?
So, well, the 21st Century Cures Act, what it put in place is a patient access rule. So, as an individual, you have the right to go into and
and then you can export the data.
And then you have the right, and we'll go through a whole step of connecting to a portal. You authenticate and log into that portal to prove who you are. You give permission to our partner, One Up Health, to put the data into our platform.
I see. So the patient can pull it out. That's interesting because
Yes.
I'm a test patient at the Stanford research, and they scan me and they basically DNA sequence me, and they track me over the years, right?
This is so cool that you do this.
Yeah. But then how are you going to handle like DNA sequence data and things like that?
It's definitely on our radar in that. But right now, what we're doing is families that are facing dementia, Parkinson's, cancer, right? So very medically complex. And learning from them, and then as well as we're moving into supporting the different agencies that support families. So when I was a nurse, so the hospital systems are all trying to figure out how to share data, but a big missing piece is when you get your care in the community, your home care, your adult day centers, your cancer associations and support groups are all operating out of binders and OneNote and Excel sheets. So we're creating that platform for them to be able to use with their family to be able to license and help to get this access.
That's fantastic. That's a great concept. So.
Yeah, so this is the share model, what Jim is showing, which is not found really in any electronic health record or any app that's out there. It's once the data and you're owning it, now you get to control who gets to see it, and do you want help editing it? So maybe I'm an aging adult and I hired a caregiver and I want her to
be able to
edit
do
and
that.
keep my story accurate, because then the next phase is how do we share? Well, we are starting to curate reports, so basically an easy button. So here's your active medication list. Now we can create that list for you to hand to your doctor at the appointment, so then they can update their system.
Yep.
And then as well as we wouldn't be at CES if we didn't try and start figuring out how we're going to use AI, the power of AI.
Of course.
So now what you can do is now you have
chat.
So now you can ask questions, and it's way better than a Google search, because now it's looking at your medical profile and giving you the answer based on your diseases and conditions and things that it sees.
Well, the use of LLM for things is a very hot topic these days, but there's a lot of issues also.
Right.
So that's very interesting space.
We tried multiple, and we're working with we tried multiple, and the ChatGPT-4 actually offered us the professional controls so that we don't persist any of that information. So that the person is offering up their information, but it's not persistent in those systems, and ChatGPT is not learning from.
Yeah, they're not worried about that. They're worried about more giving the wrong information. ChatGPT is that the issue.
So
So
our context window is it really is focused in how we structure that health information.
Yeah.
So that's where it's a bonus. We're adding extra structure.
Yeah.
So that it has less hallucination.
Very interesting.
Response.
Yeah,
I'm very excited. So.
No,
Yeah, but
yes.
Do you take care of anybody in your family?
I used to. My mother passed away, so I know all
so
that.
You live this problem, right? Trying
Yes.
to go between doctors, fighting insurance companies,
Yeah.
coordinating with the different agencies. So there's just so many tasks that our families are doing that are unnecessary that we could be
Absolutely.
using that data so that makes their life easier.
I see. Yeah, no, that's a big problem
But
to be
thank
solved.
you. I really
Thank
appreciate
you.
talking to you. So how do we follow
We enjoy
you?
it.